بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وآله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك أنت العليم الحكيم. My topic today is about differential diagnosis of internal auditory canal masses or CPA angle masses. The main differential of these masses, it is with the mnemonics of the word same S, it is for schwannoma. It is either arising from 8th or 5th cranial nerve. Aneurysm for A, M for meningioma or metastasis, E for epidermoid or epidymoma. A demographic for cerebellobentine angle masses. Most of the masses are schwannoma, either arising from 8th cranial nerve or 5th cranial nerve, more in the 8th cranial nerve, then followed by meningioma, and either in the tentorial or in the petrous, and the others it is epidermoid, metastasis, aneurysm, glioma, arachnoid cyst, etc. Here you see MRI of the patient with large mass arising from the 8th cranial nerve, and this is a schwannoma. And you see this is the T1 and this is the T1 after contrast, shows homogeneous enhancement of the mass with enlargement of the internal auditory canal. Possible also there is another mass here, it is enhancing and seen in the right internal auditory canal. Bilateral internal auditory canal masses, you should raise the possibility of neurofibromatosis. Here, another mass lesion. This is the T2 and this is then after contrast enhancement. You see enhancement of the mass in the left internal auditory canal consistent with the cranial nerve schwannoma. Here you see a large mass, hyperdense mass comparing to the cerebral hemisphere, pushing the fourth ventricle here, and causes some hyperostosis and enhancement, and with obtuse angle in the petroclevar region and in the cerebellobentine angle, and this is consistent with meningioma. Here you see a hypodense mass noted in the left cerebellobentine angle and also crossing to the right side, and it is retrocaval, and this is consistent with the epidermoid. Other differential like arachnoid cyst is indifferential, but also we depend on the diffusion weighted imaging. If there is restriction, this is the mass, it is epidermoid cyst. Here you see this is another patient with the mass lesion in the right cerebri angle on the right side, hypodense on T1, hyperintense in T2, and it is restricted diffusion, and this is a classic for epidermoid cyst. This is another mass lesion, and this is hypodense on T1, hyperintense in T2 with no enhancement and with restricted diffusion. This is a classic for epidermoid. Some differential diagnosis of CP angle masses: vestibular schwannoma, meningioma, epidermoid cyst. This is the schwannoma. It is related to the internal auditory canal. Usually the internal auditory canal is large. Sometimes it is heterogeneous enhancement if it is very large and it is round with acute angle. But in meningioma, it is related to dura and tentorium and has no relationship to the internal auditory canal and homogeneous enhancement with obtuse angle. Epidermoid, it is cisternal mass. It has no relation to the internal auditory canal and doesn't enhance, and it is undulating serpentine in configuration, and it is restricted diffusion. Here are some differential diagnoses between schwannoma and meningioma. The schwannoma, it is related to the internal auditory canal. With meningioma, it is not. Usually we see hypostosis or osteolysis in the meningioma, and it is in the classification seen in the meningioma about 20%, and it is with diffusion, it is hyper intense due to increased cellularity, and perfusion, it is high perfusion. With schwannoma, it is moderately elevated. And there is here, this in 50% of cases, there is a dural tear, and usually it is absent in schwannoma. And here it is rounded angle or sharp angle between the mass and the surrounding tissue, and here it is obtuse angle. Thank you very much, and hoping this will help you in daily practice, and see you soon.